Throughout all 30 minutes, he did not return at any point. That is patient dead for 30 minutes. And we went on until 40. Is that little line still there? Little line, yeah? With asystole, that little line remains there. And 45 minutes arrived, then people were already impatient with me, right? 3 something in the morning, nursing for the patient, right? Like, give up, right? US, please. No, there is no more. It is over.
This history begin like this.
I was born into a Christian home. I come from a family of 12 doctors. My father is a urologist. But there was a moment when I was doing my medical residency, already graduated. I ended up drifting a bit from God, not by stopping going to church, but that daily contact we need to have with God. I ended up having this, let's say, this distancing, I was a young man, a surgeon. I got into a general surgery residency program that everyone in Brazil wants to get into. With life, in quotation marks, on track, in quotation marks, a silly kid, feeling a bit full of himself about the whole situation. And actually, something happened that was extremely significant in my life, that I never forgot. And whenever I am asked to tell it, I relive it as if it were today. Mm-hmm. I was on call in this hospital, this big hospital, and I had, at the time, I am a bit older, Pastor Vilela. Did you know the time of PA of beepers?
Of course.
Right? No, cell phones were just starting, right?
It was mostly doctors who used them, wasn't it?
Yeah, doctors. But where we were sleeping at the hospital, we had the beeper. So the beeper had 2 rings. There was a normal ring and there was a ring for cardiorespiratory arrest.
Oh, really?
Yeah, so you could know if it is the arrest, you had to be quicker to go. And I was on call, and it was around 3:15, 3:20 in the morning, and I got up very quickly. The pager beeps for the surgery team when the patient is yours, and the pager beeps for the clinic team and for nursing very well. At that moment, I just looked there, it said room 109. And I went down very quickly, and I went during this time interval that I went by stairs, not by elevator. I just kept thinking, Vilela, it can't be my patient, because I had a patient in room 109 who we had operated on for a surgery. One of the biggest digestive surgeries, it is called DPT. A person with pancreatic cancer undergoes, it is called a duodenopancreatectomy. And I was thinking anxiously, it can't be him, because it was us and there were 5 patients in the room. And because I had told the family a day before that, he would be discharged the next day, because the post-operative recovery really was very good. And I was thinking anxious, it can't be him, because it was sus and there were 5 patients in the room. And because I had told the family a day before that he would be discharged the next day, because the post-operative period was really very good. And when I arrived in the room, to my surprise, who had suffered a cardiorespiratory arrest, my patient. And the clinic staff was already there. The nursing staff and I arrived, and since the patient was mine, I was the one who took over all the resuscitation there. And we started resuscitating this patient, and I, a young surgeon, I had several lessons, even regarding speaking to family members. When everything is fine for you to discharge them the next day, right? If everything goes well, if everything continues as it is, a small phrase changes a lot. And we started resuscitating this patient. And I resuscitated the patient like never before in my life, because I wanted, he was my patient. We fought for him. And normal resuscitation, anywhere in the world, there is a convention. It is 30 minutes of resuscitation. You massage, you do. There is a thing we call an ambu, which is for breathing. Adrenaline is given, atropine is given, and everything is very well synchronized. When 30 minutes hit, my fellow doctors were there too. And they said, Lemos, as they called me in residency, my surname. It has been 30 minutes. I said, guys, let's go a little longer. We went another 15 minutes. Because after 30 minutes, he didn't come back at any point. Because some patients you resuscitate, they come back and then they stop again. You continue resuscitation. That happens. It is not like, oh, he was resuscitated, woke up, everything's fine. Sometimes he wakes up, resuscitates, and then stops again. Sometimes you resuscitate 3 times, but after 30 minutes, during all 30 minutes, He didn't. Throughout all 30 minutes, he did not return at any point. That is patient dead for 30 minutes. And we went on until 40. Is that little line still there? Little line, yeah? With asystole, that little line remains there. And 45 minutes arrived, then people were already impatient with me, right? 3 something in the morning, nursing for the patient, right? Like, give up, right? US, please. No, there is no more. It is over. At that moment, something started to happen. Something that impacted my life. Something that I know was a touch from God for me. To say, look what you are doing with your life. At that moment, scenes began that I say are typical of a movie. But there it was a real story. First of all, don't ask me how the room light dimmed the face. At that 45-minute mark, that individual who was there started to move. And I, as a surgeon, as a doctor, we always want to find a plausible explanation. So as not to accept the supernatural under any circumstances, I started thinking, no, these are some myoclonias that some people can move after death. But then, for myoclonus to happen, it is right after the person dies.
Yes.
He had already been dead for 45 minutes, so it wasn't myoclonus, and he started moving as if it were a seizure.
How is it?
Like moving.
Like epileptic, right?
Like epileptic.
Okay.
Seizure. He started stretching his arms.
Wow.
At that moment,
I would run. If I were watching this linear, I'd run, right? I wasn't even in the room anymore, right? Good thing I am not a doctor, nor are you.
at that moment, all the people who were inside of that room, 109,
You had never seen this.
never in my life. And everyone left the room. Even the patients, all who could walk, those in the other beds, grabbed their IV poles and left the room. And only I and the patient remained in the room. The patient was mine. I understood this experience was for me. Obviously, I was literally like a new surgeon, terrified of what was happening there. And this man was making a face of terror, a face of pain, a face like that. Something totally uncomfortable in a panic, right? And perhaps for me, it was an eternity. I don't know if it lasted 5 minutes, 10 minutes. I know I stayed there. And I looked at the room's window that faced the street. And I saw some black figures entered, some black spirits, several, and entered inside this man through his chest. And when they entered, the face of terror and fear was even greater. And then when they left him and left through the window, that man fainted. What was clearly, I know it was the Holy Spirit speaking to me. He said, you saw this man enter hell. He was going to a place he didn't want to go. And this experience will mark your life. And whenever you can tell, you tell it. Because eternity, it is real. And we are here, Vilela, we always step in two worlds.
Exactly, we are natively spiritual, right?
We're always in two worlds, right? Because now not just talking about our spirit. Why do we arrive in environments where we don't feel good?
Exact.
Why are there people who transmit something so bad for us?
There is a spiritual reality, right? There is a reality, and that is what I say. Sometimes man doesn't realize there are spiritual forces around him, right? And I say more, God notifies us. Just as we receive a message on our cell phone, right? That someone sent a message, a civil defense alert. God notifies us through situations we face, through experiences we live. So I can say, doctor, that this experience you had, right, was truly a notification from heaven. God allowed you to see something.
There, I changed my life.
So
forever. And to everyone I can tell, I said, look, there is an eternity. I was taught, but I didn't have perhaps a conviction that I gained through this experience.
Yes. Look at that.
And there is something else I say. For example, why are there suicides in Monaco, in Luxembourg, which are the richest places in the world? Japan, why? In Switzerland, in the countries, the Nordic countries, why do rich people kill themselves? Billionaires kill themselves. Why? What is in depression? In depression that never resolves with the world's best medicines. What I receive most? I receive people from all walks of life. We are counted, we receive in our city, in Rosario do Sol, in Rio Grande do Sul, every 60 days, 12 countries who come there to be attended, consulted, or even operated on with us, right? And in fact, we know and see the oppression of different on the side. One thing I often say to someone who has no experience living in a hospital environment, why are many doctors eccentric? Why are many nursing technicians, nurses? They are different, strange, different. Many are bitter, many are bad-tempered. But it's something I'm not talking about.
Many people have problems with drugs, with alcohol, right?
With alcohol, right? With legal drugs. Yeah, okay. Because actually, here is the thing. Look, the profession in the field of medicine is the medical profession in the world with the highest suicide rate. It is 5 times more than other professions.
More than police officers?
Yes, it is the first of all professions. Wow, okay? Suicide.
Because of the pressure.
For various reasons. For various reasons. Disappointments, helplessness. But look, the problem is this. The hospital environment, listen to what I am going to say now. It is inhospitable. We who live inside it. What hovers inside the hospital? Fear. Yes. A spirit of dread.
Regrets.
Regret. Pity that it is what pity is.
Who attends people, right? Who are near death, who start to evaluate life and say, I should have done that.
And many people just pass by them like, poof, poor dying soul there. People get better. A feeling of pity. Death. It